Hello, I'm Jonathan Smith, and this is an analysis of the 6th of March 2020 for the COVID-19 pandemic going on. It is a pandemic. There might be sources out there saying it hasn't reached that yet, which is completely ridiculous. It is a pandemic. Let's go over a little bit of a few things that people seem to be confused about. They're confused about what's the difference between COVID-19 and coronavirus. Those are the same things. They are actually classed as a disease. AIDS is the disease from the virus HIV. So if COVID-19 is a disease, what is the name of the virus that causes it? That is an interesting question. So the name of the virus that causes it is SARS-CoV-2, which is severe acute respiratory syndrome 2. This is basically the second SARS number 2, if you would want to call it that. That's what it is. So it's simple, really. Let's go over some important keys here about what is going on, what shouldn't be happening, but what is happening, and just the way this whole thing is unfolding today. So Italy has 778 new cases and 49 new deaths. The case fatality rate is 6.3. The case fatality rate means that the amount of diagnosed infected and the amount of deaths that are happening within that case of diagnosed. So 778, like I said, 778 new cases and 49 new deaths. Now it's 6.3%. It might seem high for the last 24 hours. That's not actually the true rate. What's happening is that people were sick from a week ago, from 10 days ago, and now they're finally dying. But that does beg the new question that 10 days ago there wasn't that many cases. So if people are dying from those old cases, what about the new cases that are absolutely exploding in Italy? Expect the deaths, which is 50 reported, expected deaths in the next 10 days, like 10 days later from now, to be high. Probably about 100 a day or so, maybe a little bit more. It's going to go up. The important thing is here, though, that there is a 4.2% case fatality rate. A total of 4,636 people have been diagnosed and are sick from it. Obviously, there's more than that. That's just the people that we have diagnosed. But it's still a high fatality rate. Now, there are two strains. There's the one that's less severe, and then there is a more severe one going around. We could say that, oh, maybe Italy's got the more severe strain. But then you can't just factor that in. You have to factor in the country as a whole. What is the general conditions of people there and the underlying conditions? Now, Italy has a high obesity rate. Now, most people that are obese will have an underlying condition, at least one underlying condition. So that could play a role in how people are dying. It could be the less aggressive, the less the virus that has less virality to it, but it could be causing deaths because of the actual general health of these people. I'm not saying that Italians are all fat, but we do know that, like the United States, there is a high obesity rate in Italy, which will beg the question later on: how will obese people in the United States fare with this, with underlying conditions? So it's pretty high. Now let's go on about Iran. Iran is out of control. There is the new cases, 1,234 cases, is probably so inaccurate. There's likely a lot more, probably in the tens of thousands. 31 districts in Iran, or areas, would you call them? I'm not sure the name. Districts, I just call it districts, but yeah, are infected. Now, we know it's community spread in Iran. It's being spread from person to person. The cases are likely more in the tens of thousands already, which is a problem because the borders of the country are not protected from this. You know, it's gonna come out and just spread to all the countries around it, and there are many countries that have an even inferior health infrastructure than Iran. They're going to be decimated. So that's obviously we are so far out of the containment phase. We are in the delay phase. The first, when you have an outbreak, you have to try to contain it if you can from spreading. And if it spreads and it becomes community spread, then it becomes it's no longer, you can't contain it no more. Especially if it's a pandemic like it is now, you can't contain it. This is not the first SARS. The SARS was contained early, and it did die out because the R naught ended up being low after a while. It was once an R naught gets below 1, then a virus will die out because it cannot sustain itself because it needs to infect one person. The R naught is basically the amount of people that get infected that infect other people. So if an R naught 1 is that one person will infect another person generally. The flu is, I think it's 1.3%, so 1.3%, 1.3 people get infected from the flu. But we know that currently, with the information that we have available to us, that the R naught is about 2.6 or so for this, which is almost 3 people are getting infected for one person. When it's community spread, it cannot be stopped. So we're not in a containment. I have no idea why news sources are coming out there saying we need to contain this thing, and it's not happening. It's a global pandemic now, and it's going to spread and get a lot worse. Okay, so Germany has 670 total cases and 0 deaths. Now, a lot of people are confused about this. They're like, oh, how are people not dying? Germany, like, this virus must not be that bad, and this virus, like, the disease must not be killing people as bad as it seems, because Germany has a pretty good healthcare, let's say, for example. Then you have to look at the low recovery. Germany has, I don't know how many recoveries. I think it was 11 or 7, or it's on the low number, which means that such a low amount of people has recovered from it, meaning that there's probably, these are new cases. People are still sick from it. They haven't, it might be that it just exploded in the last 4 or 5 days, which it probably has. Looking at the way that Germany has increased in its numbers dramatically, like 2 times the rate of cases in the last 48 hours. In one day, I think it was a 5th or it was a 4th, it doubled. And they're probably new cases. So no one's died yet. I mean, it's probably they're 3-4 days into it of their sickness. But there will be deaths in another week or so, and their number will start going up. Okay, so now let's talk about Africa. Africa has, like, especially in, undeveloped places in Africa, there is no way that Africa can handle this sort of outbreak because they just don't have the health facilities, and people are very community based in Africa, and the lack of health education is a problem. So if it hits the more developing part of Africa, it is going to devastate Africa. They're already dealing with a lot of issues politically, economically, and through various diseases and lack of healthcare. This is going to rip apart Africa. So the case fatality rate coming out of Africa might actually be higher than any other place. Maybe 10% or so of people might just be dying because there's not enough treatment, no healthcare facilities that can really treat an outbreak massively like this. If it spreads in Africa, that is a problem. Now the United States, now I'm British, but I'm also American, so I'm both. I'm living in America, I'm American citizen, and I was born in Britain, spent half of my life there. So I'm kind of looking at this, from the USA and UK side and just the worldwide side as well. But it's really interesting what's going on here in the USA. So it is underreported. The lack of tests is ridiculous, and there is a slow rollout of tests. What that means is that the tests aren't like the tests that we have available are all we have until the rollout starts happening, and then it will be like a slow rollout of tests going from A to B to different locations across the country that need it and labs to be able to test more. So it's going to take a week or two before we get fully up to the ability to test a lot of people. And the lack of tests is just ridiculous. The hospital that I'm affiliated with has 10 tests available to it, and they've already tested 4 people, came back negative, but they don't have any more tests until they get a test kit, and they have no indication of when they will have that. Um, so yeah, that's a problem. Um, the charging of tests of money has been confirmed. People have been reporting that they are being billed for it, depending on where they get it. Certain hospitals, because we were on USA is a for-profit nation, the cost of these things is up to the place where a person is treated and getting the test. So just like someone would get charged for the influenza test, they can get charged for the COVID the yeah for having COVID-19, um, which is sad. I mean, some people are being billed $3,000 for it, which is pretty messed up. So that's going to cause community spread more, and people that are sick not going for treatment, which is going to cause more deaths, sadly, because a lot of people cannot. It's not fair to expect people to go into debt. Now, I'm sure that down the line that there will be some sort of eradication of these bills, like people will not have to pay them, like the government will do something about it down the road, um, for those who are being charged, but it's still not an incentive to get a test when you think, oh, I'm going to end up with a massive bill over it, especially if you don't have much money, right? So community spread is in the United States already. It's all over the place. The reason why we don't have high numbers is because we have a lack of tests available to us. That is, I mean, 2,000, I think it was yesterday or the day before, 2,000 tests were done in a week or 2 weeks, oh, whatever it was. And it's not enough, but of those 2,000 tests, I think 10% were positive. So I could be wrong. I'm just trying to remember all of this. Yeah, so I just expect that because of the community spread, it's spreading throughout the community. Expect a lot of cases to pop up when tests are available next week. Once again, it'll be a slow rollout, so it'll probably be later in the week, but expect a huge jump of maybe 200-300 cases a day, going up to about 1,000 cases at the end of the week. It's going to explode. The United States hasn't contained this at all, and it is now community spread. So Indiana and Pennsylvania got their first cases today. An Indiana man caught it in Boston, another proof that it is probably community spread, at an event that he went to. Way more cases than are reported, we know that. It's just the lack of tests that causing underwhelming reports for it. Most likely people have already died from this, and it's been considered the flu before a test was administered. I've been seeing reports about that. Now, some towns have no hand sanitizer available for consumers at all. Now, in my town, there is no place available. I have looked online. Everywhere there is zero stock. Everywhere. Walgreens, CVS, Lowe's, Home Depot, Walmart, Target, um, Dollar General, the dollar stores, the local grocery stores. Zero. It is all gone in my town. There's just absolutely no way to get hand sanitizer as a consumer. Um, yeah, so it's that's it. There's none available for consumers. There's nothing here. Now this is I have been hearing reports that this has been happening all across the country in different towns. This is actually bad because people need to use sanitizer to proactively make sure that when they are out that they can protect themselves. But if they do not have that, then they have you can't always, when you're out, you can't always wash your hands in a sink. You don't always have access to it. So that is actually increasing the potential for infection throughout the community of not just being from the COVID-19 disease, but it's causing influenza to spread more rapidly. That is a problem. People need to stop hoarding this stuff, and if nothing is done about it, then there needs to be government intervention to be able to supply at least hand sanitizer to consumers. Luckily, I do have hand sanitizer. I don't know why I'm getting my words tongue twisted. Luckily, I have hand sanitizer right now. If I need it, I don't have a problem with it, but it's shocking to see that some people are unable to get it. Period. Now, this is going to also tell you how bad the situation is getting. The places that do have inventory of like 12, 13 don't have it. People are stealing it. And at the hospital that I'm at, people are stealing it. Boxes of masks, an employee stealing it, and the hand sanitizer also is missing. Like the mass amounts is going missing. People are stealing it all over the place, including at hospitals, and it's getting bad. And it's only going to get worse, and especially worse when this explodes in the next week or two in the United States, and people become aware that it's not a joke. No more laughing at it. I have work colleagues that are just laughing at the whole thing, finding it to be a joke, and it's not going to do anything. It's not going to come here and all that. Well, the hospital is already making preparations to deal with an outbreak because of the lack of ICU units, for example. And the hospital beds available, it's lacking. You can't put someone with this COVID-19 in a routine hospital bed next to other routine beds. You can't do it. So specialized beds needs to be created, and when people are in ICU, most hospitals don't have mass amounts of ICUs. So if there is an outbreak in a community, for example, one hospital might be able to deal with 15 to 20 cases in an ICU, but there might be more people that are in need of that, more special care. So the United States is not doing enough, and it's not reporting testing enough, and it's just spreading all over the place. I reckon it is similar to not as bad as Iran, but it's probably in like maybe the 8 to 9,000 range already of people infected, and it probably could be worse. Okay, so the UK, there is some lack of transparency in the UK. Cases in Cornwall, which is where I'm from originally, I have family there in Cornwall, and it's kind of has been getting to me a little bit because I'd like to know where the cases actually are in Cornwall, and yet for some reason we don't need to know the names of the people, but it'd be nice to know what town or whereabouts in Cornwall, or any places. It could be in London or anywhere else, roughly where it is, so people can prepare for something like this. But the UK, the report that was given about all the cases, there's 2 cases in Cornwall. no information was given about the location. It's not transparent enough. So I cannot find out whether it's near my family or not there to, you know, help them, warn them to be careful. So that needs to change a little bit. And the daily updates instead of, you know, multiple updates is a little bit of a problem. I think that it's the UK government is trying to prevent people getting scared, but that's not going to happen because it's going to get bad before it's going to get, you know, worse before it gets better. Now here's an interesting one. The first case in Slovakia in a small town. The man that was tested positive had no travel history recently, but his son traveled to Venice, Italy, and is showing no symptoms at all. This could mean two things. This COVID-19 disease is asymptomatic, that it is spreading while people are showing no symptoms, or it could mean that it survives a long time on surfaces than we anticipated. Most viruses to survive like usually about three days on certain surfaces, up to 7 to 9 days. It really depends, but that could be either one of those two. Amazon, because of price gouging, have removed their hand sanitizer listings from their website, because what happens is you have Amazon, and when they run out of stock, then the third-party sellers then become the first place of the price of when you buy it, because they're the only ones that have it in stock. And they have been price gouging, and it is sad that people are taking advantage of this to fill their pockets of greed. So that's that problem there, but at least Amazon have done something about that, removed it so that people aren't getting ripped off $100 or whatever for a 8-ounce bottle of hand sanitizer. And because there are some none available in some towns at all, and it's been going on for about a week now, some people are getting desperate. Some people have been stealing the actual the dispensers. It was caught that somebody was in the hospital that was draining it by continuously, you know, setting off the sensor, and had been draining it into their own bottle. People are going nuts over this because of the lack of hand sanitizer available. Now, the hospital doesn't have mass amounts of supply on hand, but we are not affected like the retailers and consumers. But it's still not cool, so to say. Alright, now this is one that people are just not going over, and it is really important. Like, I cannot stress this enough. Kids are not immune. I don't know why all these news sources are saying that kids are not getting sick. Well, they're not getting, I mean, they are getting sick. They're just not getting sick, you know, as strongly as someone else, you know? And, you know, it's like they're just not getting that sick from it. They are getting sick, but they're not immune to it, and they're not suddenly, because they're not getting like massively like really bad symptoms and they're not dying, it doesn't mean they are magically resistant to getting the disease. It does not discriminate. It is going to infect old, young, middle-aged, whatever human it can, because it's the way it works. It's the virus connects to a cell, and it infects a cell, invades a cell, reproduces in the cell, and that's how it works. If it's like a jigsaw puzzle, if the piece fits into the puzzle, it doesn't matter what puzzle it is. It could be a 10 piece, it could be 1,000 pieces. As long as it fits, it's going to be a part of the missing piece of the puzzle. Now that's how the virus, they you know, it fits straight into the cell, perfect puzzle piece, boom, infected. Kids, adults. Magically, kids don't have different cells from adults. Their cells aren't special. So I don't know where this whole ridiculous rumor is going around. Now, kids have a higher R0 Um, Probably because of the way they have lack of personal hygiene or health hygiene in general. Kids do not understand how to protect themselves from this like we do as adults or young adults or older people or whatever you want to call us. They don't have that capacity to fully understand that. So what happens is that when kids get it, they are going to just absolutely spread it to other children they're in contact with and other people. And kids are potential carriers. They will most likely just carry the disease, even if they have no symptoms or they have some very mild symptoms, and they will spread it massively. Kids in schools will cause bigger outbreaks. And you know why? Because children touch their noses, their mouths, they put their fingers in their mouths, they put their fingers on their eyes, in their ears, and they touch other kids. They just don't practice social distancing at all. They're not going to in school, young kids. So schools, kids being at schools is going to make this bad. Okay, so like, as I said, kids have bad personal hygiene and they have no way to comprehend not getting this the snotty germs all over the place. And kids often don't report being sick until it's already too late, until they're really like are into it. Like kids will just be fine and they say they're okay. They feel a little funny, but they won't say that they're sick. Or parents are sending their kids to school when they're sick. Now, again, as I said earlier, the containment stage is over. We're in the delay stage, which means that we have to delay this as much as possible. Can't contain it no more. It has to be delayed until we have a vaccine available, which is not going to be for a while. Vaccines do not just come out of a lab. They need to be thoroughly tested because there are really potential adverse effects. Cytokine storms, for example, are possible to happen, which is basically where the cells in the lungs are not able to handle it, and they just absolutely just devastate the body's immune response, and organ failure happens, and the Spanish flu caused a cytokine storm, and that's what was killing people. Now, the healthier, more immune response you have, healthier immune response, the worse the storm is. But yeah, vaccines can cause that if they're not thoroughly tested enough, and we don't want that. So it's going to be 12 months, maybe 18 months. It's definitely not going to be this year. It's probably going to go through three is pushing it, maybe 4 phases or so of development in the vaccine, each phase being 2 to 3 months or so. So possibly next year, earliest maybe April next year, most likely at the end of the year of 2021, which sucks because it'll probably be mass distributed when flu season hits too. So it's going to be a problem. We just have to delay this and try to ride it out and practice a lot of social distancing and carefully isolate ourselves depending on what's happening and how bad in the community that it breaks out, and it's going to get bad. So, yeah, as I said, vaccine, the first responders are the ones who are going to be getting the first batches. So if it is ready by April, then most likely 2 months, the first batches will be given to first responders and those key personnel before it becomes widely available to the public. So that's it's not going to be fast like people think. It's going to be a year and a half, maybe up to 2 years or so. This is a novel coronavirus, which means it's new. It's never been discovered in people, and nobody's immune to it. So it takes a while to develop a new vaccine like this. Some ridiculousness of what's going on, of people reacting towards this, and they're not doing enough to think it through, what I would call bad decision making. Closing down schools in Italy until the 15th of March. Why? I am not saying that you shouldn't close the schools down. I think that all schools should be shut down. Um, what I am saying, but putting a day of 15th of March to reopen them, what is the point? This virus is like this is such an early stage. It is going to be getting worse and worse. It's not even going to peak until maybe 2 or 3 months later from now. So opening them up is just going to, kids are going to go back to school on the 15th of March, and then they're going to spread it out. They start spreading it around. Same with the schools that are shutting down and they're not opening until April 1st and stuff like that. It's not going to do any good because it's going to be peaking eventually, and the kids are going to go back and get absolutely devastated by this. Well, they're going to devastate other people. They're going to come home and infect both their parents, potential siblings, and it's other kids at school. It's going to be nasty when it starts circulating through the schools. So shutting things down for a few days, and in the United States, is so bad as well. Shutting schools down for a weekend for deep cleaning is not going to help. These schools need to be shut down. I mean, soon, before I wouldn't say right now they do, only if they have cases of COVID-19, they should be shut down, and probably shut down for months at a time at that stage, because if it's circulating in their community, then kids shouldn't be going to school and being exposed to that. So yeah, delaying the Bond movie, supposed to be coming out soon. Delaying it to November. Yes, that's great. Let's open up all the theaters in November when flu season is starting. And this virus is going to still be peaked. Maybe in 2 to 3 months it's going to peak, and then it's going to stay peaked for a couple months. And then it's going to go down. So maybe 6 months of this crap. Opening it up and having people mass run to watch it at the theater on November is ridiculous. It is bad decision making, because people are going to infect other people then, because they're contained. So it makes no sense. Now, the flu kills more people, yes, but it has a CFR of about 0.1 or 0.2% with bad ones. This has a CFR of about 3.4%. So this is, 30 times more deadly. It's just you can't compare. Now the flu spreads, and it's bad. It kills a lot of people. Like 20,000 people in the United States right now died from it. Yes, it's bad, but it does not have the potential, the killing potential, and it is seasonal. We don't know how this COVID-19 disease is going to act during summer. It might not be seasonal. It might not. And then it will just completely just destroy everything it can in its wake. So N95 masks, yes, they can protect to a certain degree, I would expect, but they do not protect the ears or the eyes. And the eyes, if somebody coughs in your direction, or you touch your hands after being contaminated and you touch your eyes, it's all connected to the nose and the mouth. You're going to get infected, and the ears too. Ears, nose, eyes, mouth are where you're going to get sick. These are entry points for viruses to enter and infect. So hand sanitizer does work. I want to go over. It does work. You need to put quite a lot on your hand, and you need to keep rubbing it into your hands and keep rubbing it, all over your hands in every way you can, and just until it dries out on your hands. You don't want to just leave it moist, because it will take longer to kill the virus that's on there if it's just your hands are just wet. So you want to dry it off like that. you know, get in between, get your fingernails, and you can do this. And your thumb, do your thumbs. You know, just do all your hands with hand sanitizer until it's dry, and that should kill it off. But I wouldn't be touching your face and stuff for at least a couple minutes. After I wouldn't do that. I'll try to make conscious efforts not to touch any of these places. People who are not taking this seriously are going to get a rude awakening soon. This is just an early stage right now. It, the blaming of China for all of this is not fair. They have been telling us what they're going through since early February. We've been aware of it since then, and it's not their fault that places have not taken it seriously and not prepared for it. It's not China's fault. Stop blaming them. They have their own issues, and most likely they're going to have more issues once they lift quarantines and people start infecting China again. They still have their cases, obviously, but it's you can't blame them for the lack of preparing for this whole thing. People need to take it seriously. I see people who are running to events, who are going on flights, on cruises. You literally, if you look up the cruise tracking, you can see right now there are like 600-700 cruises going on right now, full of people. They don't care. People just feel like they can just do whatever they want, and it won't ever affect them. But what the truth is, that they can have an effect on other people. When they get sick, they can infect somebody that is vulnerable, and that's selfishness. So yeah, my belief is that places need to be shut down. A lot of places need to be shut down, and schools need to be shut down. Homeschooling should become a thing. This is not going to blow over very easily. So we just got to brace ourselves. Now, I don't think that people should be running and panicking and stocking up on things like crazy, like this hand sanitizer craze right now. It's too early. I will say, though, that give it 2 weeks now, and you really, really need to start thinking about preparing for this. You should be preparing now, but that might be the point where it might be too, the point where you should definitely start. Starting earlier is always better. So stock up on basic things like canned food and stuff. Hand sanitizer, if you already got a hold of that would be handy. You can make your own with rubbing alcohol. Don't use vodka and stuff because that's only 40% alcohol. You can use rubbing alcohol. And anything over 60% of alcohol will be good for protecting yourself. Stock up on some necessities. Just you don't need to go crazy. Just some necessities that you might need. Some hydrogen peroxide, some medical supplies, a few masks if you can get it. And we will see how the governments react if they end up handing out packages to people. If certain communities get absolutely overwhelmed, and we'll see what happens. But this is going to get worse. I will update again tomorrow. But for anyone who is not sure about whether they can take this seriously or whether it's going to just die out in the next week or month, it's not going to die out. It's going to be with us for a long time. And yes, that's it. So I'll be updating tomorrow. I really do hope that you guys have learned something from this, and try not to pay attention to the media that's telling us that this isn't as bad as it is. It's already bad.